is the Emergency Medical Minute.
All right, so good evening, everybody. With bleeding trauma patients, we've gone towards mass transfusion protocols. And the big idea with that is that early things like fresh frozen plasma and platelets are very good, and they've been shown to improve survival rates. So there was a recent study that came out just a couple days ago, a very large study looking at giving patients plasma before they even get to the hospital. So it was a group of patients that were kind of sick trauma patients, both penetrating and blunt, who were considered to be at risk for developing hypotension and hemorrhagic shock, and they were randomized to either get plasma in the ambulance or wait till they got to the hospital. And they looked at mortality, and there was a pretty significant improvement in mortality when patients got plasma before they got to the hospital. So the patients that didn't get plasma were pretty sick. They had a 33% mortality rate, and then the ones that did get the plasma went down to 22%. So about a number to treat of 10 patients to save a life was something that's fairly simple. So logistics are probably a little complicated of having plasma that's thawed and ready to be given. So it probably works best in a high acuity EMS system where there's a lot of sick trauma patients, but it is something that could be going to that direction, and it's probably going to take some time, but hopefully at some point this could be practical enough to be given to sick trauma patients. And one more thing to improve survival. Any questions? Thanks, guys.
Thank you. Emergency Medical Minute is and always will be about free medical education. Medicine's most prolific podcast is successful because of our supporters, donors, and of course, our listeners. Please like us on Facebook and follow us on Twitter. And if you support spreading free medical education, please donate at our website, emergencymedicalminute.com. As always, keep listening.